This presentation will address the focus question: how does sports medicine address the demands of specific athletes? The presentation will focus specifically on adult and aged athletes. Adult and aged athletes are affected by three main conditions: heart conditions, bone density and fractures, and joint mobility and flexibility. It's very important for adult and aged athletes to manage these conditions appropriately to ensure they can participate safely in physical activity. Physical activity plays a significant role in reducing the impact of these conditions. Heart conditions. An example of a heart condition is angina pectoris. Angina pectoris is basically chest pains. These chest pains occur when the artery supplying blood to the heart muscle, the coronary artery, is either blocked or narrowed. This reduces the amount of blood and thus the amount of oxygen that can reach the heart muscle. This leads to pain, pressure, and discomfort. Hypertension or high blood pressure is another heart condition that affects adult and aged athletes. Blood pressure is the measurement of force applied to the artery walls. If the pressure applied to the artery wall is high, it can lead to severe damage to the artery wall. You can see in this image that the normal blood pressure has little impact on the wall of the artery. As the pressure increases, you can see that the wall of the artery is becoming more damaged. Physical activity actually reduces blood pressure. So therefore it is extremely important that adult and aged athletes participate in appropriate activities such as walking and swimming. There are several risk factors that can lead to heart conditions: smoking, sedentary behavior, a diet high in saturated fats, stress, a family history, and also age can increase the risk of heart condition. There are several exercise recommendations that need to be considered when someone has a heart condition. Pre-screening is important. Pre-screening includes seeking guidance from a GP or exercise physiologist. Warm-up and cool-down is also significant. An appropriate warm-up is important because it gradually raises the heart rate to the required level. And a cool-down is important because it brings the heart rate down to the required level after physical activity and also aids in recovery. So physical activity should also be low to medium intensity. The warm-up should gradually increase and the physical activity should gradually increase as well, but it should be at medium intensity. It should last for 15 to 20 minutes and there should be plenty of rest between activities and also between sessions. Any activity that encourages an elderly person to hold their breath will increase the blood pressure, and this should be avoided. Appropriate activities or exercise options for those with heart conditions include walking and swimming. These are appropriate because they're low intensity, they're moderate, and they have a sustained intensity. Exercise recommendations for heart conditions include applying the FIT principle: frequency, intensity, time, and type. But they should always be applied at the lower intensity level. Frequency at least 3 times per week. Intensity 50 to 60% of maximum heart rate. And 15 to 20 minutes for time. And the type of training should always be aerobic, which means it's moderate and sustained. Fractures and bone density. The main condition that you need to be aware of is osteoporosis. You can clearly see in the image that a healthy bone is quite dense. The bone on the right is an example of osteoporosis, and you can clearly see that it is less dense. Bones that are less dense are more prone to fracture, and osteoporosis is a condition that increases in likelihood as people age. Wrist and hip fractures are common when elderly people fall. And when they have osteoporosis, the risk of fracture is increased even more. There are several risk factors that lead to osteoporosis: family history, lack of calcium, low levels of vitamin D, sedentary behavior, and early menopause are thought to cause osteoporosis. Preventing osteoporosis can be achieved by quitting smoking, reducing alcohol and caffeine, increasing calcium in the diet, and also increasing vitamin D. Calcium can be increased through food sources such as dairy products, and vitamin D can be absorbed through ultraviolet rays from the sun. Preventing osteoporosis can be achieved through regular exercise. Regular exercise actually remodels and strengthens bones. When skeletal muscle pulls against the bone, it actually places stress on the bone and causes the bone to remodel or rebuild and thus become denser. So regular weight-bearing activity and strength training activities are actually beneficial for elderly people because it strengthens their bones. Exercise options to improve bone density include safe weight-bearing activities such as gardening, light weights, and low-impact aerobics. This can also help to avoid falls because it would improve strength and mobility and thus balance. Exercise actually builds strong bones. When we exercise, it places stress on bones, which leads to remodeling of the bone and thus strengthening. Exercise can reduce bone loss and exercise also increases muscle strength, which decreases the risk of falls. If elderly people fall less, they reduce their risk of fracture. Flexibility and joint mobility. As people get older, their flexibility is reduced. This is often due to reduced elasticity of their muscles, tendons, and ligaments, but also because they may be engaging in a sedentary lifestyle. If people are sedentary, their cartilage stiffens and shrinks. This can lead to limited movement and pain. Osteoarthritis is a condition that affects the cartilage between the bones. Osteoarthritis, as you can see in the image, leads to degenerated or eroded cartilage. Basically, the cartilage becomes thin and breaks down, and that leaves the ends of the bone unprotected and exposed. The joint then loses the ability to move around smoothly because the cartilage's role is to maintain that smooth movement. This can cause pain and stiffness and affects flexibility and range of motion. There are several risk factors for osteoarthritis. They include obesity, sedentary behavior, increasing age, and a prior injury to a joint. The physical activity options that can assist those that have osteoarthritis include walking, tai chi, cycling, hydrotherapy, yoga, and Pilates. All of these activities are low impact. It's important that if people have osteoarthritis, they reduce the impact on their joints. This will reduce the pain and reduce the damage to the cartilage. All of these activities are of moderate intensity. They increase strength and mobility and thus reduce falls. And they increase flexibility at the same time. It's very, very important to understand why physical activity improves joint mobility. Cartilage has a poor blood supply. That means that blood doesn't normally flow very freely around cartilage. This can make it very difficult to heal if there's an injury to the cartilage. Movement increases the synovial fluid circulation. Synovial fluid lubricates the joint but also provides nutrients to the cartilage. This controls osteoarthritis because it keeps the cartilage healthy and soft and reduces the likelihood of it degenerating and breaking. If people remain sedentary, the synovial fluid doesn't circulate. The cartilage is then deprived of nutrients and the cartilage then shrinks or stiffens. This leads to osteoarthritis and the pain associated with it. Taking into consideration all of that information is very important to consider the critical question. Explain the sports participation options available for aged people with medical conditions. First, we need to consider the key verb, explain, and also the key content in the question, sports participation options and medical conditions. Explain means relate cause and effect. This means make relationships between things and provide why and or how. The sports participation options may include yoga, Pilates, walking, or other options that may be related to the medical condition. And the medical conditions include heart conditions, fractures, bone density, flexibility, and joint mobility. When we meet next in the classroom, we're going to consider all of the information that you've just heard in this presentation, and we're going to attempt to answer this question.